Hello and welcome to 72 Dragons. Today we have the pleasure of speaking with Dr. Mary Mitsdarffer. She is a dedicated public health professional with experience in research, academia, and community engagement. Her career has been marked by her commitment to addressing health disparities, promoting health equity, and improving the well-being of children. She is currently the Vice President of the Latino Caucus for Public Health. Also, she is an assistant professor at the University of Delaware in the Biden School of Public Policy and Administration at the Center for Community Research and Service. Her background as an assistant professor, a scholar, and community advocate has made a lasting impact in the realm of public health and community empowerment. Welcome to this interview, Dr. Mary Mitsdarffer. It is an honor and pleasure to have you with us today.
Thank you. The pleasure is mine.
My name is Dr. Pietro Aparicio from 72 Dragons. Thank you for joining us, for sharing your experiences with us. Without any further ado, let's begin. You have a PhD in childhood studies, an MPH in health policy, and a bachelor's in kinesiology. How have these diverse fields of study influenced your approach to research and public health?
Yeah, that's a very good question, a very common question, because the fields feel so disparate, but I really see them as building on one another. So kinesiology is the study of human movement, and so it really informs a lot of, while my research looks at social and health behaviors, the impacts of policy on health and social determinants of health, especially among kids, you still have to have those foundations. I think you know that better than most as a medical professional. And then after my bachelor's, I worked in community health for about 4 years in Camden, New Jersey when I was completing my master's. And it taught me a lot. And I really grew to love the community I was working in. Community health was a big passion of mine. We were in schools, we were in corner stores, we were getting to know people that seemed like my family, right? And so you had this deep commitment to community, but so often being in an area that is underserved and deindustrialized, you get a bad rap, especially when you're a kid. And I saw a lot of the same narratives. I grew up on the southwest side of Chicago in Blue Island. About my own childhood, I saw it kind of reflecting back in Camden, as Camden's a violent place, and right, like who can thrive here? And it made me mad. So I went back for a PhD in childhood studies, and it's an interdisciplinary PhD that really looks at power and how power is situated, especially within minoritized classes, especially within children. We don't think about children as a minority, but they are. It made you think about rights. And I think in a lot of ways, because it's interdisciplinary, I engaged in how does literature reflect out? How does policy impact this? How does this impact our identity formation in childhood, the power structures in which we live? And over time, how does that impact health? And so I think they all really build on one another. People are always like, get the PhD in childhood. How do you become an expert in childhood? And I'm like, childhood is the most fascinating time of our lives, especially the question of who gets to have what we think of as an American childhood, right? And how, thinking about life course development, how do these formative years where you're a human being still, right? We oftentimes think about children as human becomings. And how does this impact our health throughout the life course? And we should be really focusing when we're thinking about prevention in the field of public health on kids and kids' health, and not just, are we getting them vaccinated, which is very important, but how does, the influences of things like immigration policy impact the Latino child? who was born in the US, right? And how does pervasive impacts of policy in terms of discrimination and in terms of prejudice impact kids? And even like, how does the practice of who gets to be Latino or who gets to be Hispanic in the US, right? Because so often we have populations that get boxed out, like the Brazilian population of the US from this definition, but I'm pretty sure people still feel Latino despite the nomenclature. So I think I babbled a little bit, but basically in my head, it all builds on one another, from the more sciencey bits of my early education to the more social and behavioral bits that my PhD was able to give me.
Great. Thank you for bringing up children as an important part of the public health work we do. As a native of a Mexican American community, you are committed to addressing healthcare access and services disparities. Could you share how your personal background influences your research and advocacy work?
Yeah. So I was born and raised in Blue Island, which is on the southwest side of Chicago. And it's a community that my grandparents came to and were one of the first families in the community. And I always thought I was very lucky in that we had 3 generations, my grandparents' generation, my mom's generation, and mine. And I was always surrounded by family. And I would say about half of them were like biological family, and the other half were family that became our family along the ways. My grandpa was a campesino when he first came to the US, and then came up to Chicago, worked on the railroad. And so many of the people around us, my mom grew up on a street called Irving Street, right? There was always the sense that there might not have been a lot, but there was always enough, right? And I was raised in kind of the idea of how do you help your community, because your community is your family. And I think that's why I approach kids, because Latino families, once there's baby, right, it's all about that baby, right? So there's the centering of family, and there's this joy in our next generation, and how do we develop them? And I think I was very, very lucky to grow up where I grew up, because my mom would always tell me, like, I might not be everywhere, but I have eyes everywhere, right? Which is more about like my high school years, but it's more so the idea that like there is family everywhere. And how do you support your family? And I'm excited that my work, despite the fact that I live in Philadelphia now, and my work principally is in Delaware, is able to continue to support our family as Latinos in the United States, especially for communities in Southern Delaware that are not as established as the community I come from. And so it's interesting to think about resources, it's interesting to think about policy, it's interesting to think about my own voice as a scholar, as someone who can write empirically and bring evidence to experience to be able to hopefully shift things around, right? And so I think that my community is at the forefront of every aspect of my work, even though I'm so far away from it.
Thank you. Your research interests include various aspects of children's health, U.S. policy, health equity, and more. Can you elaborate on a specific project or study that you are particularly passionate about and the impact it aims to achieve?
So my dissertation looked at immigration enforcement policy in the United States in the interior, and the impacts on children's educational outcomes, because we know in public health that education is one of the social determinants of health, right? It impacts our life course health and development. And so this idea of when a policy is in place, like interior immigration enforcement, are you feeling the tension? Is there a spillover effect regardless of status, right? And what we found is that there is. This work looked at, I want to say it was about 1,600 observations over, there's about 3,000 counties in the United States, so about half of the counties in the US. And I looked at partnerships with Immigration Customs Enforcement and county police, or ICE, as well as policies that were originated within a state itself. When a county partners with ICE, we see Latinos children enrollment decrease significantly in a school year. And that grows as time grows, right? Which makes sense, because when policy is implemented, it's not like the next day you feel it. The effects of policy are felt over time. And we know that when a state originates a policy in itself, right? So what are called omnibus immigration laws. So famously in about 2010, Arizona had something called SB 1070, or the Show Me Your Papers law, just as an example, which basically said that if someone was suspected of being undocumented, that person could be pulled over regardless if they're speeding or not, right? Which led to pervasive racial profiling, and the law was repealed within, I want to say, a year or two of being enacted because of the political challenges. But when these types of policies are originated at the state level, we actually see decreases in children's test scores. And it puts kids back by about a month of schooling, which is huge, right? Especially as Latinos in the United States maintain some of the highest high school dropout rates and are consistently pushed out of school. They also maintain some of the lowest rates of four-year degree completion, which is beginning to increase. And we know that at the PhD level, less than 1% of Latinas in the United States have a PhD, and only about 6% of professors are Latino in the US, right? So there's a major underrepresentation issue, and it starts at the beginning of the pipeline. So how does some innocuous policy, right, that's supposed to be about immigration impact an entire ethnic group of kids?
Very relevant work. Now you are the vice president of the Latino Caucus. How does your role contribute to your mission and advocacy in addressing health disparities and inequities, particularly within the Latino community, and your connection with the Latino Caucus?
So the Latino Caucus, one of the things that I love about it, one, is that it's a home for me, right? As I said, Latinos in academia are pretty underrepresented. We're only about 6%, and I am one of 2% of Latino professors at the University of Delaware, so it's kind of lonely, right? And so the Latino Caucus, one of our big missions is around development, developing students, developing professionals, developing our future scholars, and representation. And that excites me so much, because I would love it if I could see people around me who are Latino, who are leading the field, who have the opportunities here. As well as, you know, how do I take everything that I've learned along the way? I'm not first generation college, but I am the first one with a PhD in my family, right? And that was weird for me, because I always had my older sisters to be like, what do I do next? What do I do next, right? And I ran out of the what do I do next person. And so if I could be a what do I do next person for someone else who may be grappling with this, I think it's really important. And then the Latino Caucus also is a place where we can think together. I don't know if that's saying that correctly, but I've had some of the best collaborations, right? Thinking about issues that are really important to me and finding people who help me think about it in a smart way, to develop the idea, to write with them, right? Dr. Cynthia Lebron and I, we had a paper come out last year around maternal and child health and Latinas, and thinking about how Latinas are placed and situated, and disaggregation in order to really think about health disparities. And then I was able to write with Elizabeth Rojo and Kelly Umania, who are also parts of the Latino Caucus, on a new piece that we wrote that's under review in the American Journal of Public Health for a special issue on Latino health in celebration of our caucus, around basically not so much the issue of what do we call ourselves, of Latino, Latine, Latina, Latinx, right? But why the bucketing matters, how we're grouped, and how that grouping matters towards representation, towards health, and towards health disparities and the research and the equity work that we're trying to do. So it's great. I love it here. Everyone should join. It really is a home. especially at APHA. I think the first time I came to the Latino Caucus table, I think you were actually at it, and it was the poems year, the book of poems year, and I just felt at home in a way that I had not felt in a very large conference center as like a grad student who's just trying to navigate. But then I see smiling faces that seem welcoming and kind and giving me a place to land, and I've been kind of obsessed with the Latino Caucus ever since.
Thank you for sharing a very impressive career. Dr. Mary Mitsdarffer, thank you for your dedication and contributions to the field of public health. Your commitment to addressing the issues is truly commendable. We're thankful for your leadership and your passion for making a difference in public health, and thank you for sharing with us. Thank you.
Thank you.